Does hyoid suspension affect swallowing? Have you ever wondered how a small bone in your neck can impact your ability to swallow? Today, we are discussing hyoid suspension and its effects on swallowing, especially for those dealing with obstructive sleep apnea. Hyoid suspension is a surgical procedure aimed at treating obstructive sleep apnea. This surgery involves repositioning the hyoid bone, which is a small, floating bone in your neck that supports the tongue and connects to the epiglottis. The epiglottis plays a vital role in protecting your airway while swallowing. During the procedure, the hyoid bone is pulled forward and secured to nearby structures, like the thyroid cartilage or mandible. This helps open the airway and reduce the chances of collapse during sleep. Now, you might be asking, does this surgery affect swallowing? Most patients do not face long-term swallowing issues after hyoid suspension. Any difficulties that arise are usually temporary and linked to swelling and inflammation after the surgery. These issues typically resolve as the body heals without needing extra treatment. The procedure is designed to avoid direct manipulation of the tongue base or soft tissues, which are critical for swallowing. This careful approach helps minimize the risk of complications related to swallowing. However, since the hyoid bone is connected to muscles and ligaments involved in swallowing, there is a theoretical concern that changing its position could impact swallowing mechanics. Clinical studies and follow-ups with patients show that hyoid suspension generally does not lead to serious problems with swallowing function. Voice function is usually preserved as well. For individuals with obstructive sleep apnea, hyoid suspension is a minimally invasive and relatively safe surgical option. It improves airway patency with a low risk of lasting swallowing complications. Patients may experience some discomfort when swallowing right after the surgery, but this discomfort tends to improve as swelling decreases. Surgeons carefully evaluate each patient to weigh the benefits of improving airflow against the potential risks to swallowing and voice. In summary, while hyoid suspension may cause temporary swallowing difficulties due to swelling, it does not typically have a lasting negative impact on swallowing function for those treated for obstructive sleep apnea.